Okay, we are recording for Alicia, who has chosen not to be with us this morning
In our closing.
in our very last lecture together of your academic career and my academic career. So thanks, Alicia. At least you can listen to this later.
We love you, Alicia.
All right. So as we go into this information, there are some things that I want to caution you about. When we talk about alternative medications, we're talking about things that are not FDA monitored, not FDA approved, and things that you can walk over to Walgreens or even grocery outlet and get. And these are substances that are psychoactive. So they're not benign. They have some, in fact, what I'm presenting to you today are some alternatives that have some research behind them and are used in other places even more frequently than Western medicine. So I talk with people about these. I'm always careful because, again, there's not, you're not prescribing, because these are things that they can just go get on their own. But there are some of them that are going to interact with foods, some of them are going to interact with drugs, and some of them, I mean, all of them have psychoactive properties. So CAM, or complementary and alternative medicines, is a growing, well, it's been growing for a long time, area of medicine, particularly as we're going to focus on mental health medicines. There also is a national organization. Is there another person? Okay. There is a national organization for complementary and alternative medicines. I think I put that in the reference page. And they have newsletters and speakers on different kinds of alternative medicines that can be very helpful. A lot of the information that I have in this area comes from, again, the Association for the American Society for Clinical Psychopharmacology. So when we have our conferences, we'll have people who are doing research in complementary medicines come and present. When you are thinking about these for people, I'm very careful not to counter their prescriber. Most prescribers that I have worked with do not necessarily appreciate alternative medicines. Now, if you are working with a naturopath, sometimes an osteopathic physician, they will utilize them, or at least be open to them. A naturopath obviously will. And so I'm cautious, but I have had patients on some of these very successfully. The US and some other Western, more developed countries are the ones who are behind in accepting complementary and alternative medicines. We feel very comfortable with our drugs and don't quite feel comfortable with the things that are more natural. So most of the research comes from different parts of Europe. Yeah.
Well, I was just going to say that also gets at their profit line, you know.
Right.
The pharmaceutical companies, and so you're running up against more than just.
Yes. Yeah, you don't make as much money with St. John's Wort as you do with Lexapro.
Right.
Yeah. So that's true. Most of the time in the United States, when we talk about herbs, minerals, or vitamins, we think that they are safe. We think that they are all natural. And so we feel comfortable taking them. The other thing that we tend to think in the United States is if one is good, three are better. If some is good, more is better, and that's not true. And again, what we're looking at are things that are psychoactive. So I have here again, FDA does not regulate these. There are drug-drug interactions. There are drug-food interactions. There are some that will have toxicity. They will have some of the same adverse or side effects that some of the medications will have. And I'll go through some of these. And because they're not FDA regulated, that means that the formula in different brands is unknown. And so the amount of psychoactive versus the amount of non-psychoactive, often weeds, dirt, whatever, we don't know what it is. There are some formulas that have had a little bit more research. There is at least one company in the United States that will randomly pick up several different brands of an herb that is marketed for something, and they don't test it on people. They test it to see what's in it. And so they've done that with St. John's wort and have found the amount of just grasses or weeds that are in for the filler, as opposed to the amount of actual plant from St. John's plant. When you are considering this, and again, be cautious, but you want to make sure that you know what else your clients are on. Now, you can't go to Epocrates, and you can't always, not all of these are on drugs.com. So in order to find out what some of the drug-drug interactions might be, or drug-food interactions, you have to search a little bit harder to find that. Now, if you can find out what the substrate is, then you can go to your cytochrome P450 chart, and anything that shares the substrate, it will fight with. But it's hard then to know what might be an agonist or an antagonist. And so we just don't have that information available. And then to think about, how do you dose? So what I have done is use the research for dosing and use the research for helping people think through these. So we do like these herbs, minerals, and vitamins. We spend a lot of money on them. We don't consider them to be, hi Rhonda, we don't consider them to be medicine. We consider them to be supplements. We don't always tell our prescribers what we're on. And so these can be things that can cause side effects that we don't understand, that the patient doesn't understand, because they haven't shared that they're taking it. And they're just thinking that they're taking something safe that they got at the grocery store, or if they're more, maybe they got it at GNC or health store. And so they even feel more confident if they got it at a health store than if they just got it at grocery outlet. I think there's a chapter in your book on this. So look at what Preston has to say about some of this, and then think carefully about what you're doing. Here's just a little bit more. 50% of people in the United States take a multivitamin. Now, a multivitamin is a whole bunch of stuff put together in a formula that may or may not be helpful for you. And so I actually don't take a multivitamin, because for the same reason that it's difficult if you have olanzapine and Prozac in the same, which one do you need to increase and which one do you need to decrease? But a lot of people take multivitamins. But about 20% of people in the US will take some kind of herbal supplement, and whatever they take depends on what they were reading in maybe a magazine, what a friend told them, what popped up on their news source, and then they'll try this. Now, if you look at if you look at the supplements or you look at the minerals and herbs that are being sold, almost all of them will have a statement saying these statements have not been verified by the FDA. They have to do that now. But then they'll go ahead and tell you that this will relieve your depression. And and the part that says for brain health or depression or to stabilize your immune system is in larger font than the part that says that these haven't been verified by the FDA. Yes.
So I know that with vitamins, most of it just gets excreted out because our body can't absorb it. But I'm curious, like if you have a deficiency in, say, like B12 or vitamin D or something like that, and you're taking multivitamins and taking those other supplements, does that interfere, impede your body's absorption of the ones that you really needed?
Well, it depends on how they are interacting. So for instance, in order to be able to utilize vitamin C supplements, we actually have to have enough vitamin D. Mm-hmm. And so if we don't have enough vitamin D, given that we're living in the Pacific Northwest, then we can take vitamin C, and we don't excrete all of it. We do excrete a lot of it because our body just isn't able to absorb it because we don't have the combination that we need. There are, and also it depends on the routes. Like for instance, sublingual, yeah, thank you. Under the tongue B12 actually is absorbed better than if you swallow the pill. And so, so those are things that we just have to learn those things by reading different articles. And that's where the CAMS newsletters can sometimes be helpful. You will find some of this on, I think you can find some of it on, some on drugs.com, some on WebMD. So you have to go searching for these in order to learn what will help them to function better. Okay, so I started with the one we love. Caffeine is an alternative medicine. It can be used for a lot of things. Nathan says he uses it regularly. It can cause anxiety. It can cause a person to have a panic attack. And you know that when you ingest too much caffeine, particularly in the morning, you haven't had breakfast, you get the quad shot espresso, then within about 20 minutes, you can feel jittery. And so the body needs to understand how to use caffeine. Caffeine is very helpful though. Caffeine is a good adjunctive medicine for a lot of our NSAIDs. So if you look at the over-the-counter medication that you'll use for pain relief, many of them will add caffeine. And that's not so that you become addicted to the medication, but it actually helps the pain medication work better. So for instance, if you're taking ibuprofen with your coffee, the caffeine in your coffee will actually boost the pain relieving element of your ibuprofen. That's what you were doing, right, Nate? Yeah. That
makes a lot of sense.
So regulating your caffeine or helping your patients to regulate their caffeine intake can be important. Caffeine can relieve a headache. So you don't have to always get your ibuprofen or acetaminophen. You can just take your caffeine, but you have to know how your body works with it. Women and men manage caffeine differently in their body in general. And so women, the caffeine over 200 milligrams within a 20-minute period will interfere with decision-making process, whereas men can go to 400 milligrams of caffeine within a 20-minute period. Now, if you stretch out your cup of coffee for the whole morning, then that is actually stretching out. Caffeine has a fairly short half-life. And so you can feel the effects of caffeine with about 20 minutes. Caffeine does not relieve you of sleep debt though. It actually won't stop a sleep attack if your sleep debt is so great. Caffeine won't touch it. But it's in and out of your system within about 4 to 6 hours. So you can regulate this relatively well. Now, here are some other interesting things. When we are learning, state congruent learning, caffeine is one of the most studied drugs in state congruent learning. Alcohol is the other most. So I wouldn't suggest that when you're studying for your final that you use alcohol when you're studying.
Oh.
But if you, yeah,
Are we doing
so
that one?
stop that. But if you use caffeine, what you want to do is regulate the amount of caffeine you're using while you're studying, and you will retain the information and recall it better if you have that same amount of caffeine when you are taking the exam. So for instance, if you are studying and you have a triple shot, you need that much caffeine to recall effectively what you have been studying. And so they've even done these studies with people who had a cold, and when they learned things while they had a cold, they retained that, they recalled them better if they still had a cold. And so caffeine is one of them that's been looked at. Okay, St. John's wort is one of the plant-based alternative medicines that has been studied the most. It is actually a plant. I have a picture of it here. It has, you can't quite tell on this picture, it has bright yellow flowers. And it is, you use the plant. We don't know exactly what part of the plant is the best. So they use the roots, they use the leaves, they use the stems. And this is the part where you're not sure when you go get your bottle of St. John's wort, we don't know exactly which one you have. There are over 50 different types, actually over 60 different types of this plant. And we don't know which one is best. So I tried to see if we've done any up-to-date research, because this one has been researched so much. And I did find a report in the US News. It's April 19th, 2020 is a new report out on St. John's wort. And also, actually, it's not just St. John's wort, but it's alternative medicines for treating depression. And we'll talk about all of them today. I just updated things. So this is one that people are still looking at. I have had patients who didn't want to take an antidepressant because they didn't want to take depression medicine, but they needed something because they were really struggling with depression. And so I would say, well, what if you could take an herb? And I would train them on St. John's wort. And I would have them start, it's usually, the starting dose, I think, is 250 milligrams. That comes in naturally in the bottle. And then the company that, if you can get one that's been manufactured in Germany, that has been consistently the one that has the best product and has the least junk in it. When I was in Massachusetts, it was easy to find it. As I've come west, it's harder and harder to find one that is manufactured in Germany. But even, I think I saw probably about 10 years ago now, St. John's wort, they looked at the different companies, and the German company had the most active ingredient. Now, one of the things we know, and you can see it here, it's a 3A4, and you know that 3A4 is very popular with a lot of our psychotropic meds. One of the things with St. John's wort is that it will interact with oral birth control and decrease the effectiveness of the birth control. So if you're having a woman of childbearing age who is using St. John's wort, you're going to need to talk to her about this, because the birth control pill at the dose she's taking is not effective at that dose. Now, does she go and tell her prescriber that she needs a higher dose of birth control? Well, that's going to bring some different side effects. And so you may want to have her think through taking St. John's wort. The patients that I have had use St. John's wort, it has been very, very effective. It works very much like an SSRI. It has the same initial side effects. People will have nausea, they will have blurred vision. If they don't take it early in the morning, it will cause them to have some difficulty with sleeping. In 2011, Rappaport, who does a lot of research in psychopharm, did a study on St. John's wort with citalopram, and it had very similar effects. So you can take citalopram, which is going to be more expensive, but your insurance, if you have it, will pay for it. Or you can go and pay for St. John's wort, and now you're taking the risks that come with taking something that is not regulated. So the thing is, if you have a person who's taking St. John's wort and they got one brand, Nature's Valley, and then they went and they accidentally picked up, what's the other one? Nature's Destiny, I think. Those two look very much the same. And it doesn't work as well. Tell them to look at the brand they got, because just changing the brand can change the effectiveness because of the amount of active plant that's in it. It also has interactions with blood thinners. So people who have had a heart attack, who are on some kind of blood thinner, warfarin is an older one. You need to be careful with them taking this. And then people who have cancer, who've had transplants, HIV positive, they have to be, it's not that they can't, but they need to be cautious when taking this, because it will, it can cause some side effects that can be detrimental. A lot of the research that is done with our psychotropic medications, as well as the CAMs, is done against a placebo. And so another study said that St. John's wort didn't work better than a placebo. And, you know, that could be true for that study. It depends on what brand they're using. It depends on the person. It can depend on a lot of things. I also believe in the effect of placebo. And so even if somebody is taking something that is inert, if it helps them to mentally overcome some of their depression problems, then I think it's just fine. Okay, questions on this? All right, so niacin, I have the Monster drink up here because it has niacin in it. It's published. So niacin Flush Free is a brand name, and it says that it's for improving circulation of your blood. But niacin itself is related to a vitamin B. So it has some of the effects of of vitamin B. There are several different vitamin Bs, and they do slightly different things. And I don't know, I couldn't find exactly what B vitamin niacin is close to. And then I haven't been interested enough to go do a deeper dive. But it does show some research that suggests that it can be helpful in treating depression and panic and OCD. Now, I have not had patients on this, so I have plenty of patients who drink Monster drinks, but that is kind of, you know, it's kind of a stew of all kinds of things in there. And so you can't say that it's the niacin. And part of what I like to do when I'm having people consider a CAM is to be a little bit more selective rather than doing things that are in groups. But niacin, or at least inositol, has some positive benefits. And so part of the reason that it can be helpful is that it helps us with glucose. And so what does glucose do for us? Energy, particularly energy for our brains. And so it can work as a precursor for the second messenger system. And then the study, and I put it on here, Palahniuk et al. In 2001, and I haven't seen one since, found that that the myo-inositol was superior to a placebo. Now, there are other things that you can take for depression, for panic, and for OCD. But if a person is adverse to those, inositol, if you can get it without being combined with the, without being in the niacin flesh free, which you can, you just have to look for it. It might be helpful. This study said it's better than nothing. It does act like an SSRI, and so at certain doses, it will have some of the same side effects as an SSRI. And so this is where people get confused because they think, again, they think these are safe, these are just minerals, and we think of safe as inert. But if it truly is inert, it wouldn't do anything for us. And so when they take this and then they have nausea, or they can't go to sleep, or they have blurred vision, or they might, well, they wouldn't have necessarily dry mouth, then they're taking something else. But then they get frustrated and they'll think, well, the only thing I did was I took the inositol, and then they'll quit taking it. Well, if they continue taking it, the body will adjust. And then, like an SSRI, you have to take this long enough, 3 to 6 weeks, to get at a therapeutic level. And so these, again, are ones that you have to take every day in order for it to be effective. I have the studies, let's see, I think it was Palahniuk that also looked at fluoxamine in panic and found that inositol was comparable. And then Enat et al. In 2001 found that it wasn't helpful for ADHD or autism, schizophrenia, or Alzheimer's. And so it didn't have positive effects there. Okay, valerian root is, I learned about this when I was teaching a different class. And it was in a master's program, and a couple of my students were from South America, and they came up and we were talking about panic and anxiety. So it must have been a DSM class. And they began talking about where they grew up. Valerian root was used for people who had anxiety and who had sleep disorders, and they themselves had used valerian root for anxiety for a long time. So I began to look into it and learned more about it. It is another plant. You use actually the root of this plant, so you can see It looks a little bit like a fern. And there have been a number of studies comparing it with some of the SSRIs, as well as some of the medication that we use, anxiolytics, not the benzodiazepines or the barbiturates, but it does calm people down. It calms the brain down and allows the brain to do its natural induction of sleep. So it doesn't induce sleep like Ambien or Lunexa, but it does allow the brain its own ability to allow the person to turn on sleep. It can increase depression, and it can cause excitability. I have never seen those, but the research indicates that you need to watch out for that. But I have had a lot of people use valerian root.
There's a puppy.
It's Dr. Hamilton's puppy, Rosie.
Oh, Rosie, she's adorable.
Yeah.
She was just outside the window going.
Okay, I knew there was something really exciting, much more exciting than valerian root. So this, I have had people who take this in the morning for anxiety. Because it doesn't induce sleep, it doesn't make you want to take a nap in 20 minutes. And then I've had a lot of people take this in the evening, about an hour before they want to go to sleep. And then it enables them to be able to go to sleep. I had an interesting experience. So I had a student who had a real problem with insomnia and anxiety. And so I talked with the student about valerian root and just encouraged this person to try it. And so the student did try it and found that it was helpful. When we were at graduation, after graduation, a student came up and introduced me to their parent. And the mother said, "Oh, I'm so thankful for valerian root." And I thought, what? I was totally out of context. Well, the student had shared with their parents about valerian root, and the whole family now was taking valerian root, and they were loving it. So, so anyway, it is effective. It does have some side effects you have to watch out for, but I've never actually had a person talk about the side effects. Now, St. John's wort, you have to watch out for serotonin syndrome in the same way you do with SSRIs, but you don't with valerian root. And it's not addictive, other than it psychologically, people can get to the point where they can't go to sleep or that they forgot their valerian root, they feel anxious. But it's not, as far as we know, physically addictive. Okay, so magnesium is another one. And I became a believer in magnesium when my daughter was very young. And one of the things I noticed is that there were certain places where she would become very, very agitated. One of them was the Hallmark store. So I'd take her into the Hallmark store, and if we had been in there like 15 minutes, she would get really irritable. And so I thought, okay, so just too much stimulation. And so we ceased going into the Hallmark store. She still will talk about that. But I found that if I gave her a dose of magnesium, we could go into the Hallmark store in about 20 minutes, about maybe 30 minutes I'd go in, and she'd do better. But then she would have trouble going to sleep, particularly when it had been a very active day. And so I'd say, well, do you want some magnesium? And it will help calm you down. And so here is this child who has no clue what sleep meds are, but she knows that if she gets her magnesium, she can go to sleep better. Now, magnesium doesn't induce sleep. It just, again, kind of like valerian root, but not quite as powerful. It will help the brain calm down. I have not seen the positives with anxiety because the dose that you have to take is so high that it's easier to take valerian root than to take 200 to 300 milligrams of magnesium a day. But when this is one that I use regularly, partly because women in the United States in particular, and some men, and I don't know if there is a particular type of male who tends to be low in magnesium. I don't know if it's related to age or background. I don't know that, but it's so across all markers for women that in the United States, we tend to be low in magnesium anyway. So when you're low in magnesium, you're going to be more susceptible to anxiety and more susceptible to sleep problems. And so using magnesium to just kind of help. So when I worked at the PMS clinic in California, we would use magnesium and evening primrose for women during PMS. So between ovulation and when their period started, to just take that edge off of, and of course it wouldn't be severe PMS, that requires something else. But if they were just irritable, then they would increase their magnesium and they would add evening primrose, and it would just kind of calm them down. You don't even notice it until you finally recognize, oh, I was able to go to sleep. I do feel relaxed. Magnesium you can use with children because it's a natural element that we need. It's not going to do anything. There aren't side effects with it. And so it's, can you take too much magnesium? It would be a lot of magnesium to take too much. And I don't know exactly what it would do because our body recognizes magnesium and uses it.
Dr. Andrews?
Yeah.
Just side note, because I take magnesium on a regular basis. I love it. It loosens your muscles.
Yes.
So that's something to keep in mind, like for individuals, if they take too much magnesium, it can actually cause them to have loose stools. So just it is a side effect of too much. But this may be a tangent. With individuals with ADHD, they often have a magnesium deficiency.
Oh, yeah.
So taking magnesium can help to decrease some of the anxiety and jitteriness that they feel due to being overstimulated by their environment.
Yeah. Very good. Kristen?
I was actually going to say that about ADHD, but also it can help with migraines and headaches.
Okay.
I had a really significant period where I was going through migraines, and my doctor, she's like, I think you should start taking magnesium regularly. It'll help you sleep too. And so she's like, looked me dead in my eye, and she was like, but in the morning, please don't trust the fart. And I was like, okay. I will always remember that. Like, now every time.
Did you hear that online? Good, because I'm not repeating it.
You have to.
Great, our last class.
I
That's what I'm gonna remember.
Just for you.
Oh, how do we move on from this? Okay.
You don't. This is
Now we take the group picture.
Yeah. So you can, because this is something we need naturally, you can see all the different things that we need magnesium for. And and you can see that with deficiencies, nausea and vomiting. Now I haven't seen that. That would have to be probably a pretty severe deficiency, but loss of appetite, tiredness, weakness are just signs of magnesium deficiencies. And so So magnesium is critical because it's one of our essential elements. And we just don't get enough through our foods. And so you can eat magnesium rich foods, and I've got a list of them here. And not have to take the supplement, but just you want to make sure that you're eating some of these magnesium rich foods daily so that you can have enough magnesium. Things that can cause magnesium to be low is when you don't eat foods that have magnesium, but also people with Crohn's or celiac tend to have low magnesium levels. Pregnancy, well, yeah, Kristen?
I know that our soil too is being depleted of nutrients, and so
Yeah.
our foods are not actually as rich with magnesium as they should be. And I think that, like, I was just speaking with a doctor who was saying that they're pushing more and more people to just start taking it regularly,
Okay,
because of how much we are lacking just in our soil. Our topsoil is completely ruined,
yeah,
and so we're not getting the nutrients that we need in our,
Yeah.
even in our vegetables and stuff.
oh, thank goodness, because I didn't want to add more spinach to my diet.
I know. Just take more magnesium.
If you have an infection and are put on an antibiotic, you want to increase your magnesium level because antibiotics will decrease them. Just aging will cause it. And people who have thyroid disorders will be low in magnesium. So this is a critical one. And because it doesn't have all the drug side effects, it's one that is easy to take and easy to help educate people about this. Okay, melatonin has had some interesting research over the years. So melatonin is used to induce sleep. And yet our ability to utilize melatonin changes as we age. So when we have children who are born with disorders that will interfere with their sleep, so kids who are born addicted to drugs, kids who are born with brain anomalies, kids who are born with medical complexities will almost always have sleep problems. And melatonin is often the go-to for helping them be able to have better sleep. As we age, people will have different reactions. So melatonin doesn't work as effectively for some adults as it does for children. But then the studies have looked at using melatonin for jet lag, and that does seem effective with adults so that you can adjust your sleep-wake cycle as you are traveling around the world. Unlike valerian root and magnesium, melatonin will induce sleep. So it will lead you and interact with the hypothalamus so that your body will go to sleep. Some people have associated it with having increased nightmares. Now, I've not seen a study where it's been melatonin only that caused the nightmares, but when people are taking medications that interfere with sleep, they often will then take melatonin. So prednisone will cause either very vivid dreams or nightmares. And so then people will, when they're on prednisone for an infection or something, they will then take melatonin to try to get to sleep. And it's unclear of whether or not it's the melatonin or the prednisone that is causing the nightmares. Yeah. As an athlete who was always on.
No, I was on it actually in the first semester during cover letter season.
You were on prednisone?
And
I
then I
am
took
so
melatonin
sorry.
to try to go to bed,
Oh,
and
no.
then
Oh, my word.
was not having fun in our Friday classes for a couple weeks.
Yeah. 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 prednisone. When I hear that my patients are on prednisone, I just kind of cringe. I try not to let them see it because not everybody has nightmares with that. But boy, that's a drug and a half. So obviously melatonin, because it induces sleep, it will cause sedation. And for some people, they can feel depressed. Now, the not recommended for people over 20, that's because melatonin changes, but it doesn't change for everyone. And so you're going to have to work yourself or work with your patients to see if they're one of the adults where melatonin doesn't necessarily, it's not necessarily effective for them. And there are other things that they can use that can help induce sleep. Okay, omega-3s and 6s. This is another one where we need this, and it has received a lot of press. I actually absolutely believe in omega-6s. This is another situation where I was working with a person who had a global memory impairment after an anoxic accident. And so this person's short-term memory was about 3 minutes long. And so unfortunately, this was a young adult and fell through all the cracks in assistance. So didn't have insurance where he could get help, didn't have, I mean, the parents had resources, but he couldn't get any services in the state where we were living. And so the parents came to me, they came to me about 1 year after he was released from the hospital. And when he was released, well, before they released him from the hospital, the physicians told the parents to just put him into a nursing facility because he would not ever be able to function. And they wouldn't do that. So he was still ambulatory. But so they came to me and they said, can you do something? I said, well, I can't promise. But we talked about different testing we could do. We talked about different cog rehab we could do. So my students and I actually worked with him for about 5 years. I'd always get the parents' permission, but we were seeing how much we could learn. One of the things we learned through testing is that all of his declarative memory was basically shot. He lost 10 years of remote memory. So he thought he was about 16. He thought he should be in high school. He couldn't figure out why he wasn't going to high school. It really freaked him out to look at the calendar because the calendar, he couldn't figure out the time lapse. I discovered that accidentally, but we accidentally discovered that he had latent memory. He never knew it, so we had to change how we talked with him. We didn't ask him questions like, how are you feeling today? Because if I say, how are you feeling today? That means you're comparing it with something else, like how I might have felt yesterday or how I might feel tomorrow. And he couldn't do that. That made no sense. So that's what we did at first. So we had worked with him for a couple of years. And at this point, we had seen some gains that were just exciting. I mean, he could drive, but he got lost. We lost him a couple of times because somebody didn't stay with him. Because if he was standing somewhere and he didn't remember why he was standing there, he would just leave. So we had him at a job site, and the person coaching him left to go to the restroom. And when he came back, the person wasn't there. So then we're looking all over. We kind of knew where he would travel, and so we'd go there. So we're doing cognitive rehab, and we're using the driving manual because he had taken driver's training about, at this point, 13 years ago. And we knew that there were some new laws. So we were training him. We would do 2-hour sessions 3 times a week. My students were doing this, and we would give him test after test after test after test. And finally, we were seeing some gains. And finally, we took him to the DMV, and he actually took a driver's test. He didn't pass, but we saw gains. So we're keeping all of this data on him, and then all of a sudden he tanked. He couldn't remember things he had remembered before. He was doing poorly, and this had gone from a Friday to a Monday. And Friday he had been doing really well, and Monday he couldn't remember. And we always knew how to orient him. So I worked with him for years, and I never went up and expected him to remember who I was. So I always introduced. We were still doing that. Hi, my name is Sally. We've been doing work on your memory. We do it from the driver's manual. So today we're going to. And he looked more confused, but he couldn't retain anything. So I went to his parents and I said, "So what changed over the weekend? What happened? Did you add something new?" And the mom said, "Oh, you know, his physiatrist had him on 1,600 milligrams of omega-6s." And I thought, what's the use of this? Nothing's happening. And so I stopped it over the weekend. I said, okay, this is what I want you to do. At some point in the next 2 weeks, I want you to start it again. Don't tell me when. Don't tell my students, but start it again. And so she started it at about at the end of that week. And the way I knew is because all of a sudden we were back to where we were before. It was incredible. We kept working with him. And so I took him to the DMV the next time and this was several months. And see, he didn't get bored because he didn't remember he was doing this. And so I took him to the DMV. He took the test. He missed passing by 1 question. And so at that point, and the person was so encouraging, and she said, "Just hang on. I know you can do it. Just a little more studying." And so I called a meeting with the parents and I said, "Okay, I think we can get him his driver's license back. Is this what we want to do?" Because if he had his driver's license back, he could have a car and drive it legally. He was driving illegally sometimes. We'd have to go find him. But then he could also do other things, like if he went and bought alcohol, they could card him with a driver's license. At this point, he didn't have a driver's license, so if he got carded, they wouldn't sell it to him. Sometimes they didn't card him. And so they talked about it and finally decided no, that they weren't going to, we weren't going to do that because it was too high of a risk for him. That was a tough decision, but I am such a believer in omega-6s. So this omega-6s are just a long chain of fatty acid. There are different kinds. So I've listed them here. There are 2 main kinds, EPA and DHA. Most of the omega-3s and 6s now come with both, but it used to be that that they would only have EPA, and the DHA is better in the studies that have done studies on memory and brain functioning. So you get, there are different fish. I think I might have a slide about that. But there are certain plant oils. So the picture you see up there, all of those are omega-3s and 6s. And they can enhance cognitive functioning. They can be used. So Raynaud's syndrome is when a person has poor circulation and they tend to get blue fingers at times. You'll see this in people who are chronic cigarette smokers, but also people who are just having circulatory issues. They'll have blue fingers. That's Raynaud's syndrome. And so this can help that because it does increase the circulation. The increasing of the circulation and getting more glucose and oxygen to the brain is probably what really does the enhancing of cognitive functioning. And because it improves circulation, it can decrease the chance of strokes. These are the cautions. So somebody who has liver functions, impairment, you have to be careful with this because it's going to be metabolized or within the cytochrome P450. Be careful with people with depression because it can have high doses. So a dose of 1,500 milligrams is a high dose. You can get omega-3s and 6s in 250, 500. I think you can find it in 1,000. But when you're getting above 1,000, that's considered a high daily dose. If they're sensitive to aspirin, I don't know why that one happens, but you need to be cautious. And then because it can interact with depression, you also have to be careful with people who have bipolar. Here's one study that looked at the first major depressive episode in children 6 to 12. And they used randomized omega-3s using 1,000 milligrams a day or a placebo. And you can see the response rate here. So it was quite amazing what just the omega-3 would do. In the study, because they only had 28 children, it does need to be replicated. So if you haven't done your dissertation yet, this is a possible dissertation. Oh. It's also found research support, and that's a fairly newer one, 2018, for first episode of psychosis. And so it can help decrease the risk of chronic and serious episodes. So adding omega-3s. And then it can get in the way of the pathways that lithium and valproic acid use. And we use those as bipolar meds, as you know. And so this was a Harvard study. I have a second study here that shows that as people increase their seafood consumption, it decreased the bipolar, and they think that was related to the omega-3s or 6s. So one of the things, if you've ever taken these, especially the older ones, people didn't like them because you would burp, and what would happen?
Fishy tasting.
Fishy tasting. And so there are newer ones now. And so you used to take it with orange juice to try to cover up that fishy taste. But then you had fishy orange juice. And so, you know, I've never suggested that, but that's part of what that has been suggested coming from older. Too much can cause diarrhea, so you want to be careful. When so I don't, did you just say your phrase again? Okay. I can tell it's about time to take a picture. Let me just finish this slide. We'll take a picture, then we'll take a break. Okay. Some of you will just need to go outside. Did I talk about the idea that depression is inflammation? Okay, that must have been something.
I
Okay,
feel
where
like I
did you
remember
hear?
that. I don't know.
I've heard you say that before, but you've not said it.
Okay. So
I
that's-
remember hearing it in this class once, and you
What did
touched
I
on it
do?
very
That's
briefly.
where I heard it then.
Okay.
Pre or post?
I don't know what other
Yeah,
concepts
really
you're
much
talking
like
about.
pre or post match.
It must have been pre-match. So that's one of the studies that was reported in the last ASCP convention I went to, where they're looking at if chronic inflammation is really the cause behind depression, and should we be treating major depressive disorder as an inflammation rather than as a mental health hormone, a neurotransmitter imbalance. And from that, they have used omega-3s and 6s to try to treat the inflammation, and it has been found to then help depression with that that measure. And in this kind of treatment, the EPA type of omega was better. So EPA is the one of the types. DHA comes from just the fish oil, so EPA comes more from the plant oil, and that was better with the first onset of MDD, with the idea of thinking that MDD was chronic inflammation. So just some other things to think about. All right, for those of you online, before we take a break, we decided we were going to do a group picture. And so we're going to put you on the screen and the people here. So if everybody would turn on their camera, otherwise we're going to know forever that you were hiding. And so let's come up here and figure out how to.
Do we need somebody to take the picture?
Yes. Let me go.
The official photographer.
SOS Heidi.
We've got all our friends.
They can't see you until you stand up.
Yeah.
Oh, the hand.
How do we do this without walking? You gonna get on both sides?
Yeah, I mean, we can.
Well, you're gonna be behind the table if you're down there. The table down there. You're gonna be on here twice. I mean, we can turn off some.
I mean, I can go on the side, I just don't. I don't know.
Or like on the table.
There we go.
Okay. We're trying to locate a photographer.
Everyone here.
No, Alicia.
Alicia.
Alicia's trying to
Alicia. Gone.
Maybe we can crop her.
Oh, good, we're still recording.
Yeah.
And Maria, I think, as well.
Oh, yeah, Maria. Yeah. The last picture we have of all of us together is the end of second year.
That's true. Jeff
Oh,
Kelly.
Jeff's not here too.
Jeff.
That's
Jeff. He's probably having another kid.
This is probably.
Us.
Welcome to class, Rana.
I texted someone and instead of like, I wrote right ratio, but WRITE ratio. Like I was saying, I need to find the right ratio. And I used the wrong word. And I'm trying to write a defense paper, so that doesn't mean it's going well. If I can't find the right words.
Was Kristen struggling?
Where did Kristen go? Apparently she did not find Heidi.
Yeah. I'm gonna pause.
What? Great.
You don't want to leave to watch all of this?
No, she's not allowed.
So-
to know personal version.
Oh, even chalkboard, I couldn't. Chalkboard.
Oh,
You're erasing that,
Yeah.
right?
Yeah. I found like a very specific pen that does not,
I've never been.
Yeah.
the worst.
You don't like having ink all over your?
No. Pencil is impossible whenever I do it.
Yeah.
I'm like,
With handwritten tests, oh my god. That was the goal.
Are we recording again? Because I think Alicia needs to be a part of this.
Yeah.
Okay.
Alicia needs to see this.
Maybe I have a few truths.
No, I didn't need it. For 4 years.
I would lock it.
I know.
If your first year.
It's the best word that you're doing.
If you told your first year self that you're doing this.
Am I on camera?
Yes.
Oh, we're
Oh.
Oh.
That's horrible.
It's fine. It's good enough.
Oh.
That's what we learned from Dr. Andrews first year,
First year,
good enough.
right in this room.
right in this room.
You're right in the middle.
She played that video.
That would take me 2 years.
Who would have thought of that after 4 years?
All right, here we go. Rhonda, sit down. We've got things to learn. Although
Mostly about-
that's all we'll remember.
That's all.
What did you learn your last day of doctor
What did you learn in cycle form period?
Glad to be
Oh, goodness. All right, so we're going down the home stretch here, okay?
Okay.
So with vitamin B, there are several of them, and sometimes you can just get a combination vitamin B, but I'm gonna play with a couple of different things here. So vitamin B6, vitamin B12 are two of them that we're going to look at, but I'm gonna look also at elemental folate, and we'll look to see what that does as well. So B6 can be used to treat some of the symptoms of PMS. It's also used to help prevent or slow down some neuropathy. You have to be careful with certain other meds with vitamin B6, such as if a person is taking levodopa, any kind of cancer med, it will interfere with, or tuberculosis med. And it interferes with Aricept. So if you have people who are taking Aricept because they have a dementing process, you don't want to have them taking B6. And so why do we need to think about this? Well, sometimes our patients don't tell their prescribers what all they're taking, and they'll take B6 because it's supposed to be good for you. And then they'll start having some problems with the medications that they've just been put on. And so when you are asking them about their meds, make sure that you get all of their vitamins and minerals, and so that you can then let their provider know, or help them to know why they need to tell their provider about B6. When we look at the Bs, there is what's called an elemental folate. And so this is the active isomer of folic acid, and it is one of the B vitamins. We can get it from different kinds of foods, as you can see here. And the elemental folate has been found to be low in people who have schizophrenia, depression, and bipolar. And so sometimes, okay, there's a typo there. Sometimes we give elemental folate to boost, not book, but boost the antidepressants. So it can be an adjunctive too. And elemental folate is also one of the CAMs that can be used in a combination of other things to treat PCOS, so polycystic ovarian syndrome. Thank you. I forgot what the S was. And so this is one of the things that will be low in women who are having that difficulty. B9 is important to help decrease the possibility of miscarriages and some birth defects. Now, the research that I was reading didn't necessarily say what type of birth defects. My guess is that it's most likely related to the development of the spinal cord, so in that first trimester. And then B9 can be helpful with heart disease, decreasing stroke, which means that the Bs are also important in improving blood circulation. Okay, why don't I have B12 on here? Okay, let me tell you about B12. Obviously, I wasn't done with the Bs. B12 is another one that is important for
Memory.
memory. Yeah. I did take my B12 this morning. So anemia, we know, comes from low iron. But you can't just start eating liver, which my grandfather used to do. But because we have to be able to process it. Now the red meats are helpful in increasing iron as well as some other foods. But pernicious anemia has to have the B12 shot. So the B12 pills won't work as fast. Pernicious anemia will eventually cause death. And so that is because your body just isn't able to absorb the iron that we need in order to continue functioning. And so let's see, B12 was actually accidentally discovered to be helpful. It would have been in the 1930s. And so before that, if a person had pernicious anemia, they would just kind of waste away and die. There was nothing we could do. And then we accidentally learned in medicine that an injection of B12, this new discovery that occurred, it could change things around and people could live a normal life, but they had to continue to have the B12. People who drink a lot of alcohol will be B12 deficient. And then you'll see some of the problems that they will have in terms of, and we always say, health risks due to alcoholism, but it's because their body can't absorb the B12. So they will need B12 injections as well. B12 is one of them that is better if you use it sublingually. I think I already said that. And so get the sublingual pills and put them under your tongue and let them dissolve. They get to your system better that way. Okay, now I'll go to D. Vitamin D is something that we don't get enough in the Pacific Northwest, and it is a necessary vitamin. D helps us to absorb calcium, helps us to absorb and utilize vitamin C. Too low levels of D, people will feel depressed. We think it's the rain, but it's the lack of sunshine. And the sunshine actually, in order for us to get the D from the sunshine, we have to have, the retina has to have the ultraviolet light. And so you don't look at the sun, Nate. Did you hear me say that?
Well, okay, I was just, might as well start.
But you actually need to take off your dark sunglasses out in the sun for a while to be able to have your body absorb the natural vitamin D that we get from sunshine. Now, you don't have to look at the sun, but you need to take off your protective sunglasses for a while. Now, don't leave them off all day because you'll probably wear your eyes out. But vitamin D is also helpful in treating mild depression. And again, this is one that women seem to not be able to get enough of. And so when women are in a situation where they are struggling with depression, you can increase vitamin D to 10,000 and for some women, 20,000 units, and it's not milligrams, it's units per liter a day. So vitamin D will come in 1,000, 5,000 ULs. Yeah.
Yeah, it's 1 pill is 5,000.
Yeah, so look and see what you're getting because they come in different amounts. So you really do have to look at the amount, but people can take a D vitamin and they're mild, not severe or moderate, but mild depressive symptoms will be alleviated. They can also make sure that they just spend enough time in Arizona.
No,
And that
they
was
don't wanna do that. They don't want to do that. They
Oh.
will be more depressed.
Okay. Kristen says Arizona is
We have
depressing.
a
but-
different type of.
Yeah. Okay, ginkgo, check your energy drinks again. And ginkgo is branded as helping you with memory enhancement, and it can. But it is so interactive with other things that it will also cause your libido to rage, where you cannot be satiated. And
To read.
hell,
Is that going on the wall too?
So if you've ever seen, and you can get these at Walmart, but they're men's health and women's health, and they're packets of vitamins. And people just take it's designed for you to take the whole packet. Well, in that, it has ginkgo, and ginkgo will interact with a lot of our antidepressant and bipolar meds. And so even though it can be beneficial for the libido, when it is mixed with an SSRI or an SRI and let's see, like Cymbalta or Lexapro, citalopram, the libido, the sex drive, the just is insatiable. And so the person, both men and women, will just want sex all the time. Now, for women, they can have multiple erections, so they can keep going. Men, they have to wait, and they get more frustrated, and then they get angry. And I did have one husband who called and said, "Make it stop." Because his wife was calling him at work, telling him to come home. She just had to have sex, and he was exhausted. It was interfering with work. And so I didn't know what was happening, but she was doing well on Lamictal, and she was doing so well, she went and picked up these women's health. And so I looked at all of them, and it was the ginkgo that was causing it. So I just told her, stop the ginkgo and then you'll be fine. And by Monday, the husband thanked me. It was interesting. Now, ginkgo can also cause dizziness and headache, and it can cause stroke. So what it's going to do is it's going to do a little bit of vasoconstriction. And so you need to be careful with it. And when I learned that these were in some of the energy drinks, along with ginseng and some of the other things, those energy drinks are just a mess of stuff. And yet people just love them. Ginseng is interesting. There are, and I don't remember how many types of ginseng there are, but we did a study several years ago, and we had to figure out what kind of ginseng we were using. So there's in the United States, I think we use red ginseng more, but I'm thinking there are 40 plus types of ginseng, and they're not all equal. But there are some, I think it's the red that is more popular than some of the others. But the problem is they don't have to tell you what kind of ginseng. And so my students and I did a lot of research and questioning, what kind of ginseng is this? What would be in this combination? What's in this pill? What's in this drink? And we struggled. We finally decided that we landed on red ginseng because it was, at that point, it was more popular and easier to get a hold of in the United States because we were growing it here. And then we found an actual drink that we thought had red ginseng in it and not some of the others. And so we used that. But anyway, ginseng it can increase your focus, and it is used in Eastern medicine for treating anxiety and depression. So ginseng pills or ginseng drinks. And then the side effects can be increased libido again. So these women's health that have both ginkgo and ginseng, that's why it can be so problematic. And then it can cause amenorrhea in women. So if a woman her period stops, you got to look at how much ginseng and what type of ginseng. There may be another ginseng that she can use. And it can also cause a euphoria. Now, I've never had a person who had a euphoria from ginseng that I know of. So I don't know, again, what kind of ginseng that might cause. You don't want to take ginseng with your magnesium because then your morning routine will be challenging. And then it can cause hypotension. Well, Kristen got mad. So ginseng is another one that we just feel like is inert. And we take it because somebody said it would help us think better, but it is psychoactive. And so we need to help our patients and our friends pay attention to this. SAMe, when it first came out, it was to help people who had joint pain. And so SAMe is another one that you can buy almost anywhere that has, like Safeway or Walgreens. It does have the ability to work somewhat like an enzyme. And so our body recognizes it, and because it's similar in its molecular complexity to other enzymes that we have, it will break down certain hormones, and it will break down certain drugs. It is used in other countries for mild to severe depression. We don't use it in the United States here for that. People don't say, go out and get your SAMe. It does have some side effects that you have to be careful of, but it can be used, isn't that right, Lynn? It can be used to, similar to an antidepressant. It has been used for people who are struggling with fibromyalgia. And again, it's used, you'll see it with your patients with arthritis. They'll be on SAMe, but it can cause some mania. And so here's the National Center for Complementary and Integrative Health. So that is another resource that you can go to get information on CAMs. And I was looking at it the other day, and they have a new caution for SAMe, and that is that people with bipolar, this is not going to be effective because SAMe, because of its molecular formation and its interaction with some of our neurotransmitters and medications, it can cause mania, which can, if you have a person with bipolar who is doing very well and they start taking SAMe, it will shoot them, it can shoot them into a manic episode. Okay. It can also, because of its enzyme-like qualities, it can cause what looks like serotonin syndrome. So what it can do when it's interacting with hormones and neurotransmitters is it can release more serotonin than the body is needing, and therefore you will have what looks like a serotonin syndrome. The problem is if it's caused by SAMe and the person is not taking, like if they're on Depakote and then they add SAMe, it won't be seen when they go to check out why they're sweating and have a fever. It won't be seen as serotonin syndrome. So this is another place where knowing what CAMs do and understanding some of their interactions can be helpful as we're working with our patients when they seem to have side effects that don't make sense. Okay, yohimbine is used to treat impotency. It can cause anxiety. Yohimbine is similar to MAO inhibitors. So monoamine oxidase is a breakdown enzyme for the monoamine. So the indolamines and the catecholamines. So that's your dopamine, norepinephrine, epinephrine, and serotonin. So yohimbine is gonna come in and act like an MAO inhibitor, which is going to increase the amount of catecholamines and indolamines that are in your system and available for the second messenger system. Now, I mean, it can be helpful. So this is kind of like kind of a natural Viagra kind of medicine. And so again, people will take it thinking that this won't hurt me, and it can cause all kinds of problems. You can have a person who becomes tachycardic and respiratory depression. This is problematic because it will happen. It's not like they're choking and they can't breathe. Respiratory depression is that their hindbrain just stops telling their lungs to work, and it's an easy sleep. So it can be problematic that way. You can overdose on yohimbine. So I've never suggested that somebody use it. I haven't worked with a lot of men who had impotency who weren't willing to do other avenues. I mean, even before we had Viagra, there were different kinds of prosthetics that men would use in order to be able to have an erection and be able to have sex that was satisfying to them. But yohimbine is used in other parts of the world. And so when people have traveled, they may come back to the US and you may have a patient who is using this. It should not be used by women because of how it works in the body and because of the risk, and also then the risk of overdose. Okay, kava kava is an interesting medication. This is a tranquilizer that was used on animals, still is. And so then it started being used as kind of a anti-anxiety medication and a sleep med for humans in the 70s. And then in the early 90s, veterinarians discovered that dogs that were on kava kava were having stomach and GI bleeds, and it was from the kava kava. So it totally went off the market, and we didn't have kava kava on the market for a long time. Kava kava is in supplements. You can brew tea from the leaves or the roots, and then there are kava kava drinks. It has slowly come back onto the market. So you can find it in different places, but again, it's important to be careful. Here are some of the other names that are used for kava kava, depending on where you are. Here's the plant here. And so it can be toxic. It can be toxic and do damage to your liver. It can cause cirrhosis. This is a 2016 Rappaport study that looked at the side effects of kava kava. And so it was taken off the market, but in 2012, it started to be sold as a sleep aid. And so you can get kava kava on the market again now. But be careful, because it's not like it stopped causing GI bleeds, but it works well to put your dog to sleep. We used to get kava kava when we were traveling with dogs, and if I was flying with my dog, I'd give her kava kava, and she'd go to sleep and enjoy the ride. And then when I couldn't sleep, I would just take her kava kava. No, I never did that. Okay, we are actually to the end. So next week, we're going to have an educational exercise.
That's right.
Nate tried, you can just, every time he has seen me for the last 3 weeks, and he got other faculty to let me
I
know.
tried, everyone.
Yeah.
I failed you.
But we're doing this. Now, there will be, most of the multiple choice matching questions, sorry, will be over the new material. The cases will be comprehensive. Now, that doesn't mean that it's gonna touch everything. But again, on the cases, you're gonna need to be able to talk about neurotransmitters. You're gonna need to be able to talk about absorption or distribution absorption styles. You're gonna need to be able to talk about pharmacodynamics, pharmacokinetics. Obviously, you're gonna talk about specific medications. There may be combinations, so it might be a person who is on an anxiolytic or an antidepressant or an antipsychotic, and then maybe an adjunctive, and then picks up women's health meds, so, or vitamins. So just be aware of that. There will be 2 cases. Let me just encourage you to tell me everything you know. Okay, now I know you'll be tired, and I'll put those at the beginning. You can skip them if you want to.
Completely?
No,
I
and
like
then
that
come
idea.
back to them.
I like that.
Those of you who freak out when you open the test and here's this case,
I will.
then go to the multiple choice. But the students last year freaked out when they would do the multiple choice and then come to the case.
We are not that cohort.
That is true.
Yeah,
you're
no,
not.
yeah,
We're different.
that's just me.
If you, so it's either, if I put them at the end, skip all the multiple choice first, do those first, and then go back to the multiple choice. So I could put them in the middle.
I'm wondering.
Put it in the middle, please.
Put them in the middle.
I'll put them in
please.
the middle.
No, the middle.
Please
You've
don't
never
put
done
that
it. I'm assuming.
No.
That's
Like,
professional.
no, and if it's in the middle, at least.
This is your
You should
last
split
chance.
them up, put them in different, put one at the beginning and one at the end.
Okay.
Oh, well.
You'll upset everybody that way.
Okay,
I know.
okay. You're
Can
giving
I
me,
make an advocate?
okay, Megan?
The only reason why I like it at the end is there's material in the multiple choice questions sometimes, and I'm like, oh, I didn't think about that. And so I've answered a question on it. And so
Very
then you can
astute
apply it
of
to the case.
you. That is so true.
Let's put it at the end.
Okay, so here they're voting for the end.
I was more than I would.
Nate and I are just difficult though.
I think for me, as long as they're not in the middle, I'm happy.
Okay, so no middle, no middle. Okay,
I'm happy.
okay. All right.
I don't care where they are.
Okay, Beth is giving me the freedom to do what I want to do.
Said, like a true
Okay, so I'm opening your the exam at noon on Wednesday. It will stay open until noon on Friday. What?
No, because I feel like depending on where you read, sometimes it'll say noon, it'll close, or sometimes it'll say midnight. So I just want to make.
So noon. I'm gonna try to grade something in the afternoon from somewhere.
So many options.
Yeah. Okay, what questions do you have?
How are you doing that this is your last class?
I'm really excited that this is my last round of grading. I don't think I will struggle with missing grading one bit. You know, I don't mind reading what you do. In fact, I really enjoy it. It's just the grading part that's gross. And then people always tell me, well, throw them down the stairs and the ones that go the farthest get the A's. And I'm like,
I like that.
"No, but somebody won't like that, Nate.
Sure. It's supposed to be I'm the last
The person
round,
who
too.
doesn't go up the steps.
You know, I never meant to teach, and you know, I've said that before, and I've taught for 300 years now. I'm really excited to do something that I thought I was always gonna do. My plan was to work in a teaching hospital as a neuropsychologist. And then this teaching thing kept getting in the way. I mean, teaching has been a wonderful journey in a lot of ways, except the grade. But I'm excited to be able to do neuropsych. As far as I know, I won't be doing research with them, but I'm taking my own research to do. So I'll be doing research because I don't know how to handle working 40 hours a week. So I've got to have something.
Some might call that a workaholic.
Yeah. So am I ignoring life? Absolutely. But I plan to do a lot of traveling. And so I want COVID to go away. And they're a little bit behind in England, but I
And
have
it's super
plans.
cheap to fly inside Europe. So once you get there, it's expensive, but once you fly inside there, it's super cheap. So take that extra probably 40 plus hours that you're working now and use it to travel.
Yeah, exactly. And to have 10 3-day weekends in a year where they're really weekends is just so exciting. I hardly know what to do with myself.
You're gonna be going to like all these little places.
Yep.
For 3-day weekends.
I am. Yeah, I am.
Very jealous.
Yeah. Well, look how long it took me to get there. Although what I'm doing, they advertise to early career. So,
Hey.
yeah. And so you too can travel the world. I met one person I met him for the first time at APA when I was in Denver. And he's from here. I didn't know, I can't even remember his name, but he came to 2 APAs and had dinner with us. And he was in the military, and then he did stuff like this. He was more in the Middle East. And so when he came to APA, he hadn't been in the country, the US, for I don't know how many years. And I thought, wow, what an interesting way to do psychology. So I keep my Oregon license, just like if you're in the VA, you get to pick the state you're going to be licensed in, which is why we have a lot of people who are licensed in Wyoming. And then, you know, if they need me in Germany or Italy or Japan or Iceland, they're going to send me there. So I'm
Sounds like
hoping
torture.
somebody needs a neuropsych.
I know.
I'm going to stalk you because if I can get my overseas assignment anywhere near you, I'm going to stalk you.
All right, I'm looking forward to that.
I know.
Well, you will soon be leaving to various parts of the United States. So congratulations on getting this far. Don't forget that you have to log on and take the exam.
Yeah, I forgot
Meg,
already.
Yeah. We got to finish that part, but I hope you're excited, and it's just been fun being able to get to know you and work with you. So we will, I guess they're taking my Fox email. Yeah.
Even though you're still my chair.
Well, I'm gonna argue
Yeah,
that. I'm gonna argue that, but I don't know. They're afraid I'm gonna steal trade secrets or something. No, I don't know.
Yeah.
Yeah, so I'm gonna argue that I'm still chair and I'm on 3 dissertation committees.
Yeah.
And see if they'll let me keep it. But if not, my new professional email is just Glenna Andrews, PhD. So GLENA Andrews, PhD @gmail.com.
No dots.
No dots.
Two
The
A's.
case doesn't matter. I just needed it to be easy. So I'd be excited to hear from you and hear how things are going at your internships. I hope you love them. And you too will be not writing papers unless you're writing reports for assessments. Lauren goes, no way, never, ever.
Please no.
Never.
I hope you meet a lot of great people and have a good training here. And then when you come back to graduate,
We
You'll
won't know
just-
anybody.
you'll have to, I don't know if they'll even have Zoom yet, but they might, or at that point, but let me know when you're graduating and I'll cheer for you at that point. I won't have my 2-week vacation yet when you graduate. And frankly, with my first 2-week vacation for a long time, I probably won't come here again. It's not because I don't want to see you or my
That's
kids.
fair, Dr. Andrews. That's fair.
All right, thank you all.
Thank you.
Thank you, Dr. Andrews, for everything.
All right, thank you.
Thank you.